Hi, my name is Dr. Richard Tran. I'm a chiropractor, and today we're going to be discussing the issue of why chiropractic is considered safe. Now, if you've seen some of our other viewings before, you begin to really understand what chiropractic is about. You really start to understand that it's a very natural approach to a person's health care. Instead of trying to address symptoms or trying to cover up symptoms through use of things like invasive procedures or through addictive drugs, what we're trying to do is looking at the cause of the problem. We're trying to look in terms of how the nerves are functioning, and we're dealing with what already works within. In chiropractic, we believe that healing is already occurring within, and what we're doing is removing any of the interference that's involved with that innate healing process. So there's the premise is there. Well, what are the certain things that we use to be able to take measures in terms of safety? Well, it all starts with the history. Whether you've had a new injury or whether you've had it for a longer time, or even different factors like your age or your certain condition, we try to modify what types of techniques that we're actually going to use with you. We may even take x-rays as a means to really see if there are any pathological processes that we might be dealing with, or whether there are certain areas that might need more attention than others. Also, in terms of our technique, we may actually modify things like the types of techniques that we use, or even the patient positioning. We naturally wouldn't adjust a child the same way we would an elderly person or even a person that were pregnant, but these things are taken into account. With the techniques that we utilize, it's not just the types of adjustments that we might actually use our hands. Sometimes those are maybe more invasive type procedures that may be necessary, but we may also use light pressure on various areas of your spine. We may utilize blocks, which are actually used into the pelvic areas in order to help them with their mobility. We may use a certain type of table to help absorb some of the force that a person may need to take in order to have the best level of adjustment. There's even a certain type of instrument that we use called an activator, which helps us to lightly tap the areas that we need to adjust back in place. It's very safe, it's very effective, but in terms of creating the overall safety, we really want to take into account a person's history, the person's condition, and the types of studies that we initiate in order to ensure the best level, the techniques, and the type of care that we need for your safety.